Hi again, this is Dr. Sam Sunshine. Today's podcast is going to be on peptides and how they can help for recovery from injury. And if you're an athlete, chances are you've dealt with injury. No matter if you're 20 years old or you're 65 years old or older, you've probably incurred an injury. If you've never been injured before, I want your genetics. So we'll be talking a little bit about what are the structures that are commonly injured, namely tendons in the body, and those can occur in any part of the body. And what are some of the nutritional things you want to think about? And then what are some of the peptides that have been shown to help with increasing or maybe hastening recovery, which is everybody's desire. You get injured, how do you get back faster? So let's get started. I'm going to share my screen with you. And so the title of this presentation is Peptides for Injury Recovery, a Growing Aspect of Sports Nutrition. And we're in the middle of April, 2021. So this is a quote. This is part of the Hippocratic Oath. So the author of this quote is Hippocrates. This is 500 BC or so. I will use those dietary regimens which will benefit my patients according to my greatest ability and judgment, and I will do no harm or injustice to them. And so part of this talk is really, what's the science behind this? Because there is a lot of interest in speeding up recovery from injury, and what's truth and what's fiction. And sometimes that's hard to know. And there is a lot out there in social media that can be quite confusing. So my goal here is to give you some clarity, not so much specific, but clarity about what is available and what can be done to improve recovery. So what are peptides? These are hot topics. They've been around for quite some time, but they've really started to gain a lot of interest over the past, I would say, 3 or 4 years. There's now the International Peptide Society. There were peptide summits. And so a lot of people are learning about these peptides, but they're naturally occurring proteins in our body. They're short string of amino acids. So this picture to the right, which I've pulled off the internet, it shows that amino acids are like these building blocks. So when we ingest protein in our diet, chicken, fish, eggs, etc., our body breaks them down into amino acids in our intestines, and they get absorbed. And then from there, they get reconstituted back into proteins. And kind of middle step is a peptide. So it's almost like a fragment of a protein. And so these peptides, which are naturally occurring, they act as messengers, and they can activate hormones, and they also have very specific functions. So some peptides will affect one part of your body or one receptor, and another peptide will do something else. But very fascinating. And it's really, again, the information is growing rapidly. So on the picture to your right, it talks about the benefits of peptides. And at the 12 o'clock, it can be used for anti-aging. There's peptides for hair growth. There's peptides for sexual wellness, peptides for tissue regeneration, and peptides for muscle growth. So what we're going to really focus on is this tissue regeneration, which again is part of healing after an injury. And that's going to be our main focus. And common tendon or ligament injuries, again, they're both made up of these collagen fibers. Common ones are rotator cuff injuries of the shoulder. I see a lot of that, treat a lot of that. Elbow tendonitis, you have, tennis elbow, you have golfer's elbow. Achilles tendonitis, which is in the back of the heel. It's that big tendon behind your heel by your ankle. And then plantar fasciitis, which is a kind of a recalcitrant or difficult to treat problem that involves the bottom of your heel. So that's just a few of the many problems we see in terms of tendon injuries. And that's common when you have an overuse injury or even an acute injury as an athlete. You're going to likely injure a tendon. And I just say statistically, you can tear muscles, you can get open wounds, you can break bones, you can get stress fractures. But the majority of, I would say, is that I see as a sports medicine physician are injuries to tendons and ligaments and joints. So what are tendons exactly? Not to get too in-depth about this, but they're the segment that connects muscle to bone. Ligaments are also comprised of the same structure of these collagen fibrils that connect bone to bone. But again, tendons are usually what we're going to be treating when people have injury. And it could be an acute injury. What I often see in my practice are people who get injured and just aren't getting better with the natural stages of recovery, and they've done some physical therapy or chiropractic care or acupuncture. They've seen maybe a specialist and they're just not getting better. And that's oftentimes where I like to shine in my treatment. So what are some of the things that we're using? Regenerative medicine has come a long way. It's really, peptides are just on the heel of the regenerative medicine kind of platform that as doctors we have to choose. So we can use cells, which are oftentimes injected, scaffolds, which are injected. There's mechanical stimulation, which is a lot of ultrasound, Graston techniques, physical therapy, manual therapy, and then bioactive agents. Again, oftentimes things we can inject, platelet-rich plasma, exosomes, amniotic membrane. So it's very exciting time for people who want to work with a physician who's getting, who's cutting edge with these technologies. So one of the possible, and this is a little out of order, my apologies, is collagen peptide supplementation. So when you injure yourself, collagen peptides can be very effective. And this is just an article showing that oral supplementation of specific collagen peptides combined with calf strengthening exercises enhances function and reduces pain in Achilles tendinopathy. So again, there's quite a few, I would say there's a few studies looking at collagen supplementation, and collagen peptides are readily available over the counter. There are some quality products that stand out among the rest that can help. So we do know that supplementing with collagen after an injury can be effective in healing. Again, this slides are just reversed, so I apologize. But these peptides are used for recovery that I'm going to talk about, collagen peptides, which I just mentioned, BPC 157, that's body protein composition 157, Epicatechin, Thymosin beta Frag, and Cemerellin glycine. So again, for some of you, you may not have heard of these before. They are relatively new in the vernacular, but there's still, I see patients that are well-versed on these. They just not sure the dosing, the frequency, timing of dosing. But before we get into talking about the peptides, again, there are nutritional requirements for injury rehab that are equally as important. And this is a great picture that I pulled off the internet, and it kind of talks about what are some of the nutritional needs and requirements of athletes. And so it's not just, hey, I'm going to go on peptides, but you've got to factor in proper recovery. You've got to factor in proper sleep. You got to factor in nutrition and calorie needs. So this is a picture of, on the left is a male baseball pitcher with rotator cuff repair, and it kind of goes over what are the macronutrient needs, the carbs, the fat and protein requirements, and then comparing that to maybe a female with an ACL tear on the right side. What are their energy needs? And you can see they're significantly different based on weight, type of sport, and the type of injury. We do know we need protein to rehab. We need complex carbohydrates. Nutrition timing, when to be eating meals, how many meals to be eating is really important as well. Do you do it before you go into rehab with a physical therapist? Supplements have been shown over the years to be very effective in assisting with recovery. And just to name a few, and I won't go into detail with these, but creatine monohydrate, omega-3 fatty acids, essential amino acids. These are amino acids our body doesn't make, so we need those for repair. Vitamin D, as in David, beta hydroxy, beta methyl butyrate, and then prebiotics and probiotics. Again, these can also be very important for recovery. So these are things to think about and to work with a therapist or a nutritionist or a physician that's familiar with these, proper dosing and so forth. So next thing we're going to talk about is BPC 157. And again, these I've heard about and I've learned about, and now I'm supplementing with these as I train currently for triathlon this year. It's opened back up after we expect races to happen in 2021. But dealing with overuse injuries, it's quite common, especially with long duration of exercise. And as you get older, like me. So I didn't really get injured when I was younger, but I do get, a lot of muscle soreness, joint soreness, 1 or 2 days after exercising. And when you're exercising most days of the week, you get overuse injuries. They're quite common. So you gotta be careful. And that's another topic, how to prevent overuse injuries. But BPC 157, it's naturally found in stomach juices in humans. And this gastric pentadecapeptide body protection compound, or BPC 157, and its role in accelerating musculoskeletal soft tissue healing. This is done in humans. This is from 2019. So it's a relatively recent article and showing how BPC 157 can accelerate soft tissue healing. Pretty impressive. Again, there are not many things that can do this. So again, BPC 157 is going to be part of my arsenal in helping people recover from injury. The next one I want to talk about is Epicatechin. This primarily helps with increasing muscle strength. This is an article, again, in humans, and it's recent. Improvement in skeletal muscle strength and plasma levels of follistatin and myostatin, those are muscle components, induced by an 8-week resistance training and epicatechin supplementation in sarcopenic older adults. So these are adults who have kind of muscle wasting. They don't have a lot of muscle. And they put them on an 8-week resistance program. And what they found is that if they add the epicatechin, they increased muscle more so than if they took a placebo. So again, this is out of a group out of Iran, pretty impressive in Tehran. So again, there aren't a lot of human studies on these. There's a lot of animal studies, specifically rodent studies, but surprisingly, rats, mice, and humans share a lot of the same genes. And I think you'd be surprised. So we can draw some conclusions from animal studies, but again, this was done in adults, in humans. So very exciting. So another one is called Thymosin beta Frag. And originally Thymosin beta 4 has been the most studied. And I think for reasons of proprietary use of Thymosin beta 4, the compounding pharmacy that I work with is using Thymosin beta Frag. It's a fragment, but it still seems to interact with or stimulate parts of the cells to do the things they do to help with recovery. And so this is just a review. Again, fairly recent, 2016, looking at thymosin beta as an actin, which is again part of muscle binding protein with a variety of functions. Kind of vague, I apologize. Again, not a lot of information, but when you look at some of the functions or mechanisms of action of this thymosin beta, just stimulation of new blood cell formation. It seems to accelerate the secretion of vasoactive growth factor 1 in stimulating the growth of new blood vessels. Inhibits other pathways that kind of enhance inflammation. It accelerates healing in skin wounds. And they're actually working on topical forms of thymosin beta for healing superficial wounds, regulation of the immune system. They're also using it to help heal ocular injury and to treat dry eyes. So a lot of interest in thymosin beta, and it can be used for injury recovery as well from musculoskeletal injuries. The last one I'm going to talk about is the semirelin glycine. Semirelin is a growth hormone releasing hormone. So it's a little peptide that, or I say a peptide, they're all kind of little, that stimulates or attaches to the receptor on the pituitary to stimulate the release of growth hormone. So it's upstream, stimulates the pituitary so that your body makes increase in growth hormone. And this can be used short-term for injury recovery. And there are some people who have adult onset growth hormone deficiency and could go on this on a regular basis. Again, I'm not a big proponent of growth hormone replacement or HGH, partly because I don't know a lot about it, and there's just not a lot in the literature. There's not a lot about these growth hormone releasing hormones either, but they, to me, appear safer. They have fewer side effects. There are pretty significant side effects with human growth hormone replacement in humans. And this study looks at the activation of these growth hormone releasing receptor. And again, this is what the semirelin will stimulate to reverse remodeling and stimulate cardiac cell function after having a heart attack. So myocardial infarction is a heart attack. And what they've shown in this study is that people, even a month after having a heart attack, can improve their diastolic dysfunction by going on semirelin or these growth hormone releasing secretagogues, they call them, to help still stimulate cardiac cell function, which is huge. One of the things I want to caution about, there's a lot in the literature about supplement use safety, and I think using things willy-nilly can pose risk. And I don't say that lightly. I know people who just, if they hear about something, they're going to start taking it, and if they're not getting the results, they'll just start to increase their dose oftentimes, and that can be potentially risky. So there are a lot of articles about the adverse effects of nutraceuticals and dietary supplements. I mean, the percentage of athletes or even bodybuilders who take supplements is pretty significant. It's very high. And then the number of athletes, bodybuilders, weekend warriors who take supplements is pretty significant. Oftentimes, they don't know what they're taking. Sometimes they're very sophisticated in their knowledge and they know more than physicians, but those are few and far in between. And they're the ones who are usually educating the younger guys who are in the gyms about which supplements to be using. But I would say, do your research. Look for it. Look in PubMed. Try to find if there are human studies using that supplement. Try to learn the dosing. Try to learn the frequency. Do you take it periodically, or is it an ongoing use? Do you take it with a meal, or do you take it in between meals? So these are things you need to find out, or you can come to a doctor who has some education in this area. So I'm just going to finish up with a final quote, also by Hippocrates. Again, he was the father of medicine, and this is also part of his Hippocratic oath, which in essence is to do no harm. So long as I maintain this oath faithfully and without corruption, may it be granted to me to partake of life fully in the practice of my art, gaining the respect of all men for all time. However, should I transgress this oath and violate it, may the opposite be my fate. So I hope this was helpful. Again, this is a very small part of injury recovery, but it's going to be of growing interest to people just like you. Again, this is Sam Sunshine with OC Sports and Wellness. This is a primary care sports medicine practice in Orange County, California. If you are interested, you can go to OC Sports and Wellness. If you are viewing this because you're a current member of my practice and you want to talk more, please set up an appointment with me and we can discuss this further. And I look forward to seeing you then. Thank you so much.